Empower to Integrate, a collaborative initiative by Aditus Foundation and the African Media Association Malta. This program is dedicated to advancing integration and social inclusion for third country nationals in Malta. It is funded by the Asylum, Migration and Integration Fund, co-funded by the European Union and carried out in collaboration with the Parliamentary Secretariat for European Funds.
Welcome to the Empower to Integrate project. This is a platform for third country nationals to boost their visibility, amplify their voices, and share their perspective. It also aims to strengthen community empowerment and build social ties in Malta. Hi, I'm Nazli Mayu, and I'm the project lead strategist and the radio show host. Today we will be talking about that we need to understand that not everyone can cope. We will also delve into migrant women's health and access to services and education, and how language can be a barrier for them. This also includes the impact of social isolation, unemployment, family separation for migrants, and how it can affect their mental health and well-being. Joining me in the studio today is Dr. Valeska Padovese. Hello and welcome.
Hello, thanks for the invitation, and I'm very pleased to be here.
Thank you. Dr. Padovese is a senior consultant and clinical lead at the Genitourinary Clinic in Malta. She's also the ILDS Special Advisor on Migrants' Health, STIs, and HIV, and leads the ILDS Migrant Health Working Group. In 2023, she co-founded the international NGO Bridges to Health and Rights and operates at the intersection of health and human rights, integrating disciplines such as medicine, law, and criminology. Her primary clinical and research interests focus on skin diseases and sexual health in migrants and other vulnerable populations. I'd also like to give a warm welcome to our second guest, who is Ilan Dalli.
Hello. Thanks for the invitation.
It's
a pleasure being here.
Thank you and welcome. Ian is a lecturer at MCAST, where he has been teaching in the automotive section of the engineering department for over 13 years. In 2025, he completed a master's in STEM education from the Institute of Education in Malta. His research focused on how third country nationals access vocational higher education, drawing on their lived experiences. He explored the push and pull factors shaping their journeys and the EU-level processes in place to address these challenges. His findings highlighted key barriers, including agencies working in silos, poor collaboration between services, and a complex educational system that can be difficult to navigate without prior familiarity or guidance, which together often left TCNs underserved by the support available to them. Dr. Valeska, what lessons from the global migrant health work you've undertaken do you think Malta can apply to better support migrant women's well-being and sexual health?
Yes, so I really think that we can improve in this field, especially if we try to work together. So the multidisciplinary approach when we deal with migrants women is very important. For instance, I'm a sexual health doctor, I'm also a dermatologist, and partnering or working with different organizations, including non-governmental organizations, is very important to reach out to migrants women to empower them with education and information about their sexual health and their rights, and also offering, improving, their access to services through information about how the health system in Malta works. Plus, close collaboration also between different doctors like gynecologists, venereologists, and also specialists in different disciplines like psychologists, social services, and the use of cultural mediator might help to improve access to care for migrant women, especially for the most vulnerable.
And Ian, could you share some of the positive findings of your research on third country nationals who access vocational higher education in Malta and how it impacted their lives?
One of the most positive things that I encountered was that whenever they needed some help, locals were ready to help. Although, as already mentioned, most services work within their boundaries, once the TCN, the migrant, tries to approach, the people working there are always ready to help and guide them. There is a sense of mentoring, although not official or not structured, that people want to help others access the services.
And from your point of view, how important is it to integrate community-based healing and emotional support along clinical practices, especially for vulnerable migrant women? Because we come from different backgrounds and have different views or values and beliefs, so sometimes we could be misunderstood.
Yes, sure. I always work in before I moved to Malta. So I moved to Malta 12 years ago, so now I'm almost Maltese, I can say. But I always work with migrants and other vulnerable population in Italy, where I come from, and in different setting. Let's say I work a lot in African countries, and knowing better the culture in the country of origin obviously help also the doctor to understand better the difference in beliefs and the way also they interpret signs and symptoms when they present with a condition, skin condition. I'm a dermatologist, but also with some sexual health related symptoms. The person that I usually use or support me during consultation are cultural mediators. I call them cultural mediators because they are not simple interpreters. Mm-hmm. They help us to bridge the gap between the language from the country of origin, but also the culture of the country of origin. So sometimes we can face instances where migrants are referred to some cultural belief because they are used to think about some particular situation related or use of herbal treatment or local medicine, and we need to understand better, and the cultural mediator can help us explaining what are they meaning and why they are addressing to some conditions in relation to like sexual health or skin health. So this is very important.
Mm-hmm. Yeah, it is quite interesting.
I can contribute what was the doctor already saying. Sometimes the mentality of treating third country nationals or migrants is they are like a homogeneous group. So they have a certain background, they have a certain culture. But in reality, when dealing with TCNs and migrants, one need to think of a heterogeneous population, different backgrounds. So we cannot create a service that one size fits all. This is the process because of cultural backgrounds. Interpretation of medicine, what is medicine for them? It's different for different populations, obviously.
Yeah, because you also mentioned like dealing with skin, where you find that what medication that you could use is different to what I could use. So, are there areas or any tips that you can share in terms of helping migrant people get the help that they need?
In terms of skin, I was thinking about some cultural bowel syndrome more than because I'm talking mainly about sexual health today here. So there are some migrants and they refer to some sign or symptoms in their body, and these signs are something that they really feel, but they're related to some really cultural or religion background. So I'm thinking mainly to men. There is a syndrome is called Dutch syndrome, when some men coming especially from Southeast Asia, they have a feeling of burning sensation, or they see the pollution in the morning, so they lose sperm, and losing sperm is like a vital sign, so it's the lymph and the vital sign, and they think they're losing power, and they internalize more this feeling and these symptoms, and they end up going to different doctors, and they do a lot of investigation, when in reality it's really a cultural bound syndrome. So it's related to the culture and what they believe, and obviously this is a natural phenomenon that need to be explained, because losing sperm in the morning is something that is normal for men, for instance, but it need to be interpreted. Okay, that's what I refer to.
Mm-hmm. It's also interesting in terms of what you're saying is that it's not being dismissed, because this is what this person is feeling, and it's not saying that that doesn't exist or negating it, but actually helping them work through the process.
Yes, concerning skin, there is also the belief that white skin is better than dark skin, and so a lot of migrants women, they apply bleaching products, and this can cause a lot of issues for skin, because they use corticosteroid or other products that they import from their country, and this can cause skin atrophy, hyperpigmentation, so the opposite of what they want to achieve. So it's very important to explain also these things related to their culture, because for them white is nice, beautiful, whereas our concept of beauty is very different. For instance, no, we get tan, and if you think of the past habit to use sunbed to tan or going a lot in the sun, because the tan is healthy and is nice. So this is related to the different culture.
And could you share with us, Ian, what are some of the push and pull factors that attracted migrants or third country nationals to Malta, and how could the EU processes support their transition?
Some of the push factors is also sometimes related to the cultural behavior when processors or accessing governmental services. So like, okay, this will be done later, or for locals, it's normal how you call, you follow up, but for certain cultures, it's like an efficiency from the government that must work. So that is sometimes something that pushes away or creates a sense of being stuck in the system. In the case of education, the process of getting into education is understanding the process, not just the process, how it works, just understanding what to do and things like that seem to be a push away factor. So, and these things often leads to a sense of status quo, I call this. So the migrant has a problem, tries to access it, tries to solve it, will find shut doors or does not understand the process, how it works. Sometimes it comes also from culture, how certain things are called, so they can be misleading or misinterpreted by the migrant or by the services. And this creates a status, a position where the migrant will prefer to stay in their situation, and leave everything going away. A pull factor that attracts or is this sense that if they access or if they ask, there's always a sense of someone will help you, someone will give you access, or something will happen eventually. And services exist, but to access to them or to understand how they work, they need to have a little bit of guidance in how to access them, and that guidance exists a lot, especially when migrants create what is called a bridge social network. One thing that I saw that it is very important is when migrants have a friendship or create connections with the locals, even things like religion, culture, how to call things, how to access basic services. When you have a bridged social networks, meaning that you are mixing with locals, migrants have gained an upward moving socioeconomic status. So they improved socially, they improved economically, they obtained better positions in their employment, they gained better access to education. So mixing with this or using a bridged social network helped a lot to access these products or services, let's say, and it is something that locally works a lot. So once you approach the locals, the locals are ready to help and help you. Accessing and going back to what happens in the EU, something that is happening in the EU is everyone is working on their own. So we have, for example, recognition of qualifications. We have countries like Ireland and Finland are at the forefront. We try to imitate them. We study how they work. And then, like in Malta, we still need to start up, or we still need to implement it correctly. On the other hand, for example, Malta, the recognition of prior learning. So if you have a qualification from your country origin and you need to show it here in Malta, on the other hand, we are at the forefront of these things. So the process is easy, it's fast. Within 3 days, they get the qualification. And then there are other processes like a tailored approach. Links a little bit back what we were saying in the beginning, that there is no single background for every migrant or for every third country national. So having a tailored approach, meaning talking to the migrant, to the TCN, what do you bring with you? What are your needs? What do you need? Helps to create a service where third country nationals or migrants can navigate easily.
Okay, thank you.
Can I add something?
Yes, you may.
So I like the way you describe the process of integration, because at the end that is a process of integration that is the most important thing. But we have to also stress the point that you said at the beginning, so migrants are not an homogeneous group. So if a migrant is irregular or irregularized because it doesn't have document, or asylum seekers or refugees, so there are different categories of migrants and they have different backgrounds. So also their knowledge and their education can obviously affect, migrants escaping from Somalia, for instance, or from a country where there is really poor education and they didn't have a scholarization, the opportunity to study. The integration is much more difficult and complicated. This is what I saw in my experience. Other refugees, I think about groups like Ethiopians or Eritreans, they build up a good network and they live in a community, and these communities, as you say, help a lot to support basically not only the bridge with the local population but also within their own community.
Their own community,
yes. And there are also NGOs, migrants NGOs in the community, and working with them also in terms of empowering migrants. So the message, the campaign, and in terms of sexual health is a key element that help really to bridge the gaps and manage to inform them about give the message that we want to pass, basically. This is what I mean. Yes.
That's quite interesting, and thank you for sharing your view around that there. If I could stay with you, from your perspective, what are some of the biggest barriers migrant women face when trying to access reproductive or sexual health services?
Yes, I mentioned some of them before. The legal status can be one of the biggest barriers to access services, but also obviously linguistic and cultural barriers. So they don't know how the service works. They might have a linguistic barrier, so they don't know how to communicate to the staff with the staff, the healthcare providers. They don't know how to reach the service. Sometimes I'm leading a European funded project. It's called Reach Out, Integrate Healthcare for Migrants and Hard to Reach Population. And I always say in a provocative way that maybe the population are not hard to reach, are our services that are hard to reach. So created services that are more cultural sensitive, so including cultural mediator, or having a consultation, a service integrated with interpretation service, like we finally managed to get in Mater Dei where I work, so having interpreter at least on the phone, speaking the different languages and helping during consultation is already a step forward to inclusion and reaching out to this population. And then other barriers, I mentioned already the legal status, so the fact that migrants who are not regular, so irregularized migrants, might be concerned about being reported or deported if they reach out to our service and if we find out that they had an infectious disease, for instance. So these are all issues that, and the stigma, when we talk about sexual health a lot, the stigma is very important because there is an internalized stigma against HIV, for instance, and the fear of being diagnosed with HIV, the fear of being rejected by partners, by friends, by the society where they live, and also the fear of being deported if they are diagnosed with an STI, including HIV. And this is part of the research I'm doing in the last year, so we have to work decreasing stigma, not only in the general population, but also in the healthcare providers, because we know that stigma is present everywhere, also unfortunately in the health sector.
Can I connect a little bit what Doctor is saying to my research? Is sometimes at a policy level, at a government's level, let's say, integration is not the real integration as intended, that it is a two-way process. The migrant that is here and adapts to our culture adapts and accepts the culture. Oftentimes, I notice that when we say this is an integration process, we created this project, it's more of an assimilation, what is called. So the migrant must adapt to us. She must learn the language, she must adapt to our culture. So most of the time, we blur the lines, we say this is integration, but in reality it becomes assimilation, where the migrant must totally adapt to our culture, to our process. So, and when designing policies or governance or authorities in that manner, we tend to forget the background, the baggage, and the cultural upbringing of the migrants who try to access the service.
So perhaps we should design our services having migrants from the community part of the team of people who design
that
the
is,
service.
for example, a process that I see happening is a top-down approach. It's not only limited to Malta, mostly in most EU countries. So the government consultants make the research. We need to do these things. This is passed on to the authority, to the helpers, to the officers, etc. In some countries, like for example Belgium and Germany, the multi-stakeholders, they are called, for example, the migrants, NGOs, employers, the education system, work together to create the paths, the project, the processes. So they start from the needs and lead to a policy, not a policy, and everyone needs to adapt to fit or change their paths to adapt to the system.
That's quite interesting what you're saying, because then there might be people who are left out.
Exactly.
Because they're not fitting in, or they don't fit into that criteria. So doing it the other way is quite interesting, and that's also what this project is about, is to bring awareness of what migrants are going through and their perspective and their voice, so that you can, before you create the policy, you can hear their stories. So yeah, thank you. And Ian, for you, what stood out the most regarding the emotional and psychological burden migrants carried when they were trying to figure out the system?
Something that I noticed a lot is they have like a fighting spirit, so they keep on going. So someone like a humanitarian, it takes a lot of courage to leave your country, leave your family, and start over again. You need to fend on your own. So, and they keep on trying, keep on like fighting. They find closed doors. So when some of them just give up, is that they have tried and kept trying. They also have a very entrepreneurial mindset, entrepreneurial in the sense that they have a plan and they actuate it. So I'm not talking business, like it's like I need to get this qualification. After this qualification, I have a plan to start working there. After working there for 5 years, I need to do. So they plan out and they have everything set in place. And another thing is I meet a lot of adolescents and let's say minors between 16 and 18. And they are much more mature than the locals for their own age. They plan, they budget, nothing is free for them. So there's this mentality. It's like talking to a 27 to a 30-year-old who is already taking care of a family. So these factors, when facing these barriers, creates this, let's say, survival instinct, but it's what they need to do to manage to live. So in reality, it creates better women and men for our community, I think.
Mm-hmm. Yeah, so lots of benefits that came out of your research.
There is a great potential, I
yes,
think.
There is a great potential,
that the
and
country should use.
I may mention 2 stories that were in the media. One of them was a nurse. She was sleeping in the bathroom of her friend and studying. I had also a student to gain years. He used to work during the night, find a job to work during the night and study in the morning. So he could gain some years to get into the university quicker. So there's this entrepreneurial and fighting spirit that it's impressive sometimes.
Which is probably related to poverty and the background.
Poverty
yes.
and trying to get out of that system.
Of the poverty, the system, yes.
Yeah.
So
and also coming from, I'm from Africa as well, where we don't have social services or government that you can rely on, So if it's not your employment, and, most countries also, if you don't have employment, then it's your family. And if your family are struggling, then it's on you, And usually the eldest child will be sent away from Africa to go and seek the fortune. So when they're studying in the bathrooms in the evening, it's because they know they've got family as well back home.
Yes, most of them need to support their family either here or they need to send money.
Yeah. Mm-hmm. Okay. And lastly, my final question, what message would you like to give to migrant women who are listening, especially those who may be struggling silently and afraid to seek help?
Obviously, our doors are open in terms of medical doctor, work in the public service, the genitourinary clinic, in terms of sexual health. We recently also decentralized the service. I'm talking again about the process that we have done, because Primary healthcare is the service where most of migrants, including migrant women, can access as first entry point with the National Health Service. And we train doctors in primary healthcare on sexual health. So we open community clinics where migrants and other local population can be seen by a GP and eventually then refer to our service. So we decentralize sexual health to reduce waiting time, waiting list, and to provide better access to sexual health to the general population. Plus, what we have used is very technical, but I think is important to know also rapid diagnostic test, a point of care test for HIV, syphilis. We are out in the community with a mobile clinic. Is a European funded project. As I mentioned before, the name of the project is Reach Out, and maybe you can see our big van is a partnership with different organizations, with NGOs, St. John's Ambulance and Rescue, with IOM, with FSWS, so the social services. So we are there with social workers, with lay people, with cultural mediators to offer these services at community level. And we offer information, education about STIs, so sexually transmitted infections, sexual health, how the system works, but also tests, rapid diagnostic tests for HIV, syphilis, and hepatitis. They are free, anonymous, confidential, few minutes, a drop of blood, and in 5 up to 10 minutes, the results are there. So I invite everyone to follow us. We are advertising on Facebook and the social media to attend this service, because it's important to know your status, and if you have problem to discuss with the doctor in our team, we will refer you to the service.
Thank you very much for sharing that. And I'd also like to thank you, Dr. Padovese and Ian, for coming along today and sharing your expertise and your knowledge with us today. Thank you very much for joining us, and thank you for tuning in.
Thanks
Thank you very much.
Thank you
we
very much.
enjoyed. Thank you.
All right, and goodbye.
Empower to Integrate, a collaborative initiative by Aditus Foundation and the African Media Association Malta. This program is dedicated to advancing integration and social inclusion for third country nationals in Malta. It is funded by the Asylum, Migration and Integration Fund, co-funded by the European Union, and carried out in collaboration with the Parliamentary Secretariat for European Funds.